such a privilege to be part of this event today and hearing each of the speakers. And I feel like everything from very early this morning with Jim talking about meeting people and making intentional time and devoting that time to your relationship building, all the way through the 10 Ps, which is the very next thing, but all the way through placemaking, wine, all of that matters and especially has an impact on our health. And so when we talk about blue zones, what we're talking about is how are we developing cities to support the health of its citizens. And so I want to dive right in with a little bit of like what is driving the culture around well-being and why does well-being fit into this space of developing and rising cities. When we talk about post-pandemic world, what's really become clear is healthy communities are economically vibrant communities. Healthy communities mean that you have citizens who can engage in all of the great aspects of developing community that we've been talking about today. But in America, as many of you probably know, we have a really big disadvantage. We have a very sick workforce that costs a lot of money, costs employers a lot of money, and it costs residents a lot of money. Disproportionately high percentage of their salaries, more and more, are going to paying for health care. We have a declining life expectancy. So when we think about where we were in 2019, which is on the left side of the screen, 79 was our average life expectancy. As of 2021, we're already down to 76. That's 3 years lost of life expectancy. When in 2019, Daniel Doss was writing his book, The Political Determinants of Health, we were looking at life expectancy in the United States losing, some steps, some pace over the next 30 years. And really what has happened is we have dropped from about 46 in the ranking around 215 countries down to around 64 in just 3 short years. And so today we're facing, how do we turn that around? We're looking at a future where our children are going to live shorter lives than we do. And that's despite spending more than 10 times our peer nations. And this is also the greatest source of bankruptcy still in the United States is healthcare debt and struggle to pay those bills. So what is a well-being economy and what does that mean? It means building a reciprocal nature or relationship where healthy citizens help drive economic impact and cities help protect that and devote their time to developing healthy cities where people can continue that virtuous cycle of giving back and developing cities and driving economy, et cetera. And that has to happen across the board. It has to happen for all Black people, it has to happen for all brown people, it has to happen for immigrants, it has to happen for our seniors, our disabled, our children, et cetera. So it has to be across the board, it has to be equitable. I just mentioned some stats around where we're ranked in terms of longevity and life expectancy compared to the rest of the world. If we in the United States were to break that down by demographics and we were to say, okay, if all the white people in the United States were a country unto themselves, they would be ranked 50th. They would be better off than where we are today. If we were to say all Black Americans are a country unto themselves, they'd be ranked around 75th. If we were to say all Native Americans are a country unto themselves, they would be ranked around 130. So we talk about equity, but it's not until we think of it in those terms that we realize the need for creating equitable space, equitable design, access in our communities. This concept of well-being economy is really at a tipping point, and especially since the pandemic. What we have is an increase in mental health awareness, a reduction of shame around getting treatment for mental health. We have innovation in that space. We have stressed out workforce, so we're looking at things around ensuring that our employees have better access to understand how to manage their stress. Lifestyle-related diseases, COVID-19, of course, and then what we call the silver tsunami, the growing, aging, disproportionate to the rest of the community. And this is creating that demand for innovation, and I've already mentioned some of those, into the well-being space. And this is validated by a study that Deloitte took on, who says, actually, all of this study that's gone into saying that we're going to be spending $11.8 billion in the next 20 years is actually wrong. And the thing that's going to change that is everyday people having a demand for greater support for well-being in their workplace, greater support in their communities, in their city design. Probably many of you know about health in all communities when we talk about city policy, planning policies, et cetera. And this difference between where we're projected to have medical care costs and where Deloitte imagines it will come in is an opportunity for us to capture that spend and say, how are we going to use those dollars differently? And we feel like Blue Zones has been at the cutting edge of also this validation process. What we have seen in the last few years is a demand from cities to come in to support them, looking at full community transformation. How do we talk about all aspects of the conversations that we're having today? How do we engage citizens to come out and take notice of the things that are going on in their community, to have a voice in the design of their community, and to engage with their neighbors, to get to know their neighbors? How do we work on proving this and measuring it? How do we know that what we're doing is having an impact? And Blue Zones has been busy validating that approach, and we've gotten a number of things that have given us to let us know that we're on the right track, and that includes the Surgeon General, now 3 different Surgeon Generals who've written in their report Blue Zones as a proven strategy to do that. So what is Blue Zones? Blue Zones, the original research and the concept comes from an early 2000s study that was taken on by National Geographic and Dan Buettner, a fellow of National Geographic, and a host of demographers, researchers, et cetera, that traveled around the world to understand where people are living the longest, but not just the longest disease-free life. And it's important because they were using the age 100 as the marker. So where in the world are people living to age 100 at a higher rate than we do here in the United States? And what they found is there are 5 key communities across the world where this is happening. And these communities didn't necessarily, set out to be in the top 5 list of places where you live to be age 100, but instead there was something going on in their community that contributed to them living longer life. If you look at these communities, they're not necessarily the Naples of the world or Monterey, places where we have current modern day projects where you would say the income is disproportionately high. No, on average, these are below the poverty line type communities, struggle with many of the things that we do here in the United States, modern day, but they had some important commonalities, which we call the Power 9, that actually were contributing to a longer life. And we call the Power 9 here moving naturally. So just every day, part of their daily life, whether that's walking to, the grocery store, their corner markets, whether it's riding a bike to get to work, gardening, getting up and down out of their garden daily, et cetera. We're giving them just every day a little bit of extra move. They weren't going to the gym, they weren't working out, et cetera. The right outlook, being able to live their life with purpose, getting up every day excited for what the day had in store for them, being connected by loved ones that they maybe were giving back in a purposeful way, downshifting, managing stress in natural and normal ways that were just part of their culture. So how do they step away from stress? How do they manage that stress and downshift? When we talk about eat wisely, this is really cultural elements that they didn't overeat. We could call it the 80% rule, but there's actually terms for that where they would consciously stop eating before they were full. Plant slant, this is not saying let's take on a vegan or a vegetarian diet, but how do we prioritize whole grains, fresh fruits, vegetables in our everyday diet that in saving meat portions, making them smaller, saving them for celebratory things, occasions. Friends at 5. This one is tricky because sometimes it's wine at 5. And I go back to our friends at City Winery and some of the other earlier conversations about wine. And I love the concept of the neighborly Sundays, or whatever he called that earlier, because that was really cool, because that's really a concept around the Blue Zones. It's how do you come together with friends to share in what's gone on in your week or your day, generally at 5 o'clock at the end of the workday, and really kind of building that camaraderie, that friendship in that space. Connecting, this is really about community and belonging. Does the community support you? Do you feel like your community is right for you? Do you feel like you can easily give back to your community and that community is going to be there for you? Putting loved ones first, or family first, whoever you identify as your family. This is, making space for revering your elders as they age, taking care of loved ones. Today we struggle in the workspace around, can we have time off? Can we take care of our loved ones as they're aging? If your parents get dementia, are you going to put them in a home? Or are you going to have a flexible workspace that's going to allow you that space to do that? So there's a lot of that kind of discussion that's happening. But putting your loved ones first is pretty important. And then right tribe, again, going back to that concept. In America today, there was a survey that came out a few years ago that said modern Americans have less than 2 friends. I think it came down to 1.5 friends that they can call on a good day, or that they can call on a bad day when things are not going so well. And what we know is having the right circle of friends can either reinforce good habits, or they can reinforce bad habits. And so the whole focus here is, how do you have friends that are supportive, are there and helping you to reinforce a healthy lifestyle? So how does Blue Zones take these Power 9 and infuse them into a community? And we've now done this over 75 times in what we call full community transformations. We've also worked in a number of large work sites, including Delta Airlines, for example, where we go in and we look at their environment and we look at everything from top to bottom. We're looking at policies. We're looking at what are the types of policies that have been enacted that might be contributing to some bad outcomes, what some in the healthcare world now call social determinants of health. There are intentional policies that have had harmful effects. Redlining, for example, excellent example. So how do we go into a community and look at the full scale of policies and develop a plan to right those wrongs? How do we correct some of those policies? How do we bring needed policy change for things that have needed to happen for some time? We also look at people engagement. How are people engaging today? Where are the spaces that they can engage? Where are the green spaces? Where are the venues? What is the culture around engaging? What is appropriate for that community? And we also look at places. So everywhere you might go in what we call the life radius, it's normally considered about 20 miles from where you live, where you probably spend a good part of your day, probably even more so today as much more of us are working from home. We may only, that circle may be as small as 5 miles where you go in the course of a day. So how do we get those places to develop environments that are going to support healthy choices? That includes working with faith-based organizations where people gather to pray. That includes grocery stores where you may be shopping to buy your food. That includes looking at work sites and schools and universities, wherever people are gathering in large numbers. We want to make sure that we're working with those institutions to develop policies and environments that are going to continuously nudge people towards healthier choices. And how do we accomplish that? Earlier today, we talked about the 10 Ps. So when we as Blue Zones go into a community, we're not looking at doing anything for the community. It's more about being that connective tissue that is bringing community leaders together. And we look for community leaders that span the spectrum from healthcare services to nonprofit groups to economic development to foundations and corporate partners. And really bringing them to the table to say, if we're going to achieve the goals that you have set out, and many times we're reviewing master plans and we're reviewing all kinds of things that people have put intentional work to, but it's been sitting on a shelf for 10 years, hasn't been funded. They have been unsuccessful in getting it passed through City Council. But the intention is still there and the goal is still there. So we come in and we help broker and bring together some of those partnerships to say, okay, this can't be the city's plan unto itself, and it can't work if the community's not bought in and doesn't see themselves reflected in this plan, and it can't work if we don't have funding that's aligned with the goals of the whole community to enact this plan. And it may mean that the plan has to change a little bit. But what Blue Zone's project has been successful in achieving is creating a system of shared measurement. What are our goals? How are we measuring this? And accountability to enact it on a timeline that might seem aggressive to what most city planning and community planning teams look at. So while they may be looking at a 20-year horizon, we probably are looking at a 4 to 5 time horizon. And that includes marquee projects that are going to be in the built environment. That's going to include marquee projects that are going to be in the food space, food policy space, and access space. And that's going to include creating a tipping point of community engagement that we can measure, that people have come out, they're participating, they're aware of, and they know of what the work that's going on in their community. And that is what we would call a full community transformation, when we've reached that tipping point and we know that the good work has happened and we have a team that's planned on the ground that they can sustainably move that into the future and continue that work, is when we can say that we've been successful.
What a great presentation. Let me ask you this. I think when cities get managed, a lot of times they know what their GDP is, they know what their economic growth is, they have all this data that they track. When you add longevity and the health of its citizens to the list, what are the data points that cities should be tracking?
There's a lot of data out there, and some would say we have too much data. And it's finding and deciding what is the true north. And I think you can't, as a city leader, say, this one data point or that one data point. Has to be what's important to your community. And so in some communities that we go into, that seems like a very obscure data point, but it's their important data point, and it always goes back to health. And I'll give you an example. We worked in a small Pennsylvania community where they had probably on average, 600 water turnoffs. This is in a city of 6,000 people. So this is not, this is 10% of their population was having their water turned off each month. And so what they know from that is it's winter, there's a number of children that are living in these homes, there's all kinds of other issues. Their main goal was, how do we, one, stop that? And if we stop that, what we're going to stop is the cycle of people moving in and out of homes. We're going to stop a cycle of children not being in school and a number of other things that go to health. So I know where you're going to, but I think for every community, that metric is different, and it always points back to what's best for its citizens.
Yeah, I think that's the thing about, people hear about this blueprint to follow, and there are some general rules, but then it needs to be customized to the community,
Absolutely.
And the community needs to be part of that process.
Absolutely.
To express those needs. In terms of, so there's the city government piece. In terms of the private sector, there's a growing movement where employers feel a responsibility for the health of their employees. First, because they're usually paying for some of their insurance premiums, but also because they really want a healthy workforce. What's the role of private employers, and do you have any partners you can cite that have been really helpful?
Yes, most definitely. Some of our biggest projects, Fort Worth, for example, knocking on the door of 1 million residents. We have a pretty robust project that's going there. And what we have been successful in doing is bringing out a lot of those corporate partners in Fort Worth. And to your point, yes, they're looking at their bottom line and how much it's costing to cover their employees, but they also are beginning to realize every resident in a given city is potentially a future employee, and therefore potentially a covered life on my insurance plan, and their families are too. And so stepping into this space of supporting communities being as healthy as they can and showing up in a way that's different than just sponsoring the Little League team. Not that they shouldn't do that, but it is a little... Are you coming out
against Little League sponsorships right now?
I am not, but it is a different type of investment. It's an investment that says we care about this community, we want to see a healthy future, and by the way, it's going to impact their bottom line. And we have had some very large health systems that have brought Blue Zones in just to do that. There's not a community project. We're just there to help them around their environment and their culture of well-being, and develop them leadership to support that, with the goal of down the road bringing it to the full community. And they're starting kind of in-house first to test it and prove the concept and get buy-in before they take it outside their walls, but has been very effective.
Let's give a hand to Margaret. This is a great presentation.
Thank you.
Thank you so much.